common question patients have when they've torn their rotator cuff or when they're undergoing any shoulder surgery is, how long do I have to wait to drive after shoulder surgery? And I'm here to tell you, right, something that hopefully eases your fear about having shoulder surgery, at least with us, is that you can drive right after surgery, right? You can drive right after surgery. Driving requires that you put your hand below 90 degrees. It doesn't require a lot of weight bearing. We have newer data out there that shows that it's perfectly safe to do this. And what I've also realized across my career is patients are going to do what they want to do, right? And so even if I tell people you can't drive, they're going to go drive. And what I haven't seen is this litany of car accidents from people driving. So what I tell patients, for every shoulder surgery we do, you can drive right after surgery, right? Now, here are some of the caveats, right? You've got to be comfortable and feel safe, right? If you don't feel like safe and comfortable driving because you're just not ready yet, then you're not ready to drive. So start off by, having a relative or a family member or spouse or anyone drive with you around the neighborhood in a really safe route to just make sure that you can handle everything. And you can't be taking the strong pain medicine, like the narcotic type pain medicine, while you're driving. So if you're having so much pain after surgery that you need the narcotics during the day, then you're not driving, right? So that's like drinking and driving. So you can't do that. So as long as you're not taking the narcotics, and you feel safe, you can drive right after shoulder surgery without fear of getting in an accident or putting yourself in harm's way. And also, it's not going to damage the surgery, right? Like, it's not going to damage what we did by using your hand and arm in the way that you need to in order to drive. But you can't be taking the pain medicine, and you got to feel safe. You got to feel comfortable. Those are the two main things. But yeah, we let everybody drive right after surgery. That's a big fear. Most of the concerns and fears people have about shoulder surgery is not whether or not it's going to work or solve their problem. It's that 6 weeks to 3 months after the surgery, just thinking like, oh my gosh, how am I going to live? Like, this is going to be so horrible. And I think, what we've tried to do in our practice is liberate people from those viewpoints to say, yes, it's surgery. Yes, you're going to have to, there's some things you're going to have to back off on, but you're going to be able to live your life after this surgery and still function really well. And eventually, everything's going to heal up and you're going to have a great shoulder. So it's not nearly as bad as the vast majority of people picture it to be after they have the surgery, with the way that we counsel our patients. So again, the answer to the question is, when can I drive after shoulder surgery? Right after the surgery, within a day or two. The second you feel comfortable.